Today, I signed an executive order that loosens some restrictions in MERC Regions 6 and 8, also known as the Upper Peninsula and the Greater Traverse City area. Starting this Friday, people in those regions, starting Friday at 12:01 a.m. to be exact, people in those regions can reopen retail businesses, restaurants, and bars with limited seating. So this is a new way of dining, but we're going to be very careful and we're going to engage slowly. Office work that cannot be done remotely. And I want to be very clear that these businesses have got to adhere to the worker safety requirements that I mentioned before. The choice of whether these regions fully engage these sectors of their economy also depends on their local governments. If they want to take a more cautious course, they're free to limit the operation of restaurants or bars within their jurisdiction, including restricting such establishments to outdoor seating.
So, Governor, I'm just saying, I'm not so sure it's a brilliant idea to open the bars at midnight. You know, you might want to do it at like 8 o'clock in the morning when people are, getting their morning coffee and just waking up. But opening the bars up north at midnight, where, people like to tip a few up there, I'm not so sure that opening the bars at midnight is such a good idea.
Starting Friday at 12:01 a.m. Starting Friday at 12:01 a.m. Starting Friday at 12:01 a.m.
Did you say, when are you going to open them?
Starting Friday at 12:01 a.m.
Starting Friday at 12:01 a.m. I don't know if you saw what happened in Wisconsin when finally, after months and months of people being all pent up and inside with nothing to do, I'm not so sure that things aren't going to get a little bit crazy well, I hope not. I mean, I'm not trying to encourage anything. Now, fortunately, people in northern Michigan, they don't listen to this show. But, oh my goodness, it's going to be. When I heard that news, I was amazed. I was very happy that we're beginning to make progress. And why not with things around the state of Michigan improving, our numbers getting better each and every day, opening things up. She always said she was going to open up in zones around the state of Michigan. But I think everyone was caught off guard a little bit with that announcement yesterday afternoon at 2 o'clock. Got Dave Scott here in the Megacast, Tyler Keefe in our studios. We thank you for joining us all across the Megacast network. Why not? Sure. Okay. Tyler is telling me to hit a button or two. So, thank you for joining us. 89.3 Lakes FM, 88.1 WBFH, The Biff, WAHS, 89.5 Avondale Community Radio, Civic Center TV on Channel 15 Comcast, and then on 99 on AT&T, and then Birmingham Area Municipal Access as well, tuning in the Birmingham area. We thank you very much. And also, a huge thank you to the Walled Lake Consolidated Schools. And we will talk to their superintendent, Ken Gutman, coming up in a couple of minutes. So thanks for tuning in. So Tyler Keefe, good to see you again. I know it's been a couple of days. That was a surprise yesterday. I mean, a good surprise, I think, right before the Memorial Weekend, opening up restaurants and bars in northern Michigan. But were you also caught off guard a little bit?
I was definitely caught off guard a little bit by the announcement. I heard word of it. It was reported just slightly before the time that the governor took the podium for her press conference that was going to happen. And it was kind of surprising that of all times to open, particularly the bars and the restaurants, right before Memorial Day weekend, just about a week before, a few days before Memorial Day weekend, and especially at that time of night, as you mentioned. It's an interesting decision.
I'm making a little joke out of that, to be honest with you. They had to open it sometime. It's just kind of funny that
go to the bars for forever.
It's just kind of funny she called extra attention to that in the press conference. It's going to open right at midnight. So here we go. So the bars and restaurants will open in northern Michigan. Michigan Restaurant and Hotel Association couldn't be happier. They were at the press conference yesterday, and the big thing, getting serious now, the big thing that we hope here is that goes really well. It goes smooth. People behave themselves. They keep their social distancing, and it all works out well because the rest of the state is watching. And if things get screwed up in northern Michigan, then that'll be an excuse, right? And I'll chase down the video during the show today, but we do have video somewhere around here from when they opened things up in Wisconsin, and it was a little raucous. But what do you expect? People have been, they've been locked into their homes for 60 days now almost. So we have that going on. Also in our list of headlines, big news came out just a couple of hours ago that all Michigan voters will get an application in the mail for the upcoming election in May and in November. So we'll talk about the implications of that. Joining us in a couple of minutes, Administrative Lieutenant Erik Tilli of the West Bloomfield Police Department. We're seeing things start to bubble up a little bit, Tyler. I think it's safe to say, not in our communities here, but elsewhere around the state, that law enforcement has taken a position in some communities, local sheriff's offices and others, that they are not going to enforce all of the executive orders. And that's been a little bit disruptive, especially up in Owasso, where that barber, refused to stop serving people, and the sheriff refused to, to enforce the state laws and executive orders. So we'll talk a little bit about that. Ken Gutman will be joining us. Tyler did a beautiful interview yesterday with folks from Lansing talking about the budget crisis that we're going to have here in the state and how that's going to affect the schools.
It's definitely a hot button issue right now, and even after the interview last night, we also here at Civic Center TV we broadcast the West Bloomfield School Board meetings, and it was continuing to be an issue there. I don't know if they listened to the Megacast or they were participating in the
every single board member. They are all tuning in every day,
or if they were just paying attention very closely to the revenue estimating conference and knowing that the budget cuts are potentially $600 to $650 per student per pupil at this time. It's a significant cut, and a lot of school districts, West Bloomfield said it last night, Ken Gutman said it previously, it's a kind of setback that could push them back potentially to where they were at in 2008.
So we'll take a look and see what those numbers are. I mean, that number sounds good to me. We heard others say that number could be as much as $2,000 per student. Ken Gutman, Superintendent of Schools, checks in from Walled Lake in a couple of minutes. We'll talk to the mayor of Sylvan Lake, our good friend, Mayor Erin Lorenz, checks in a little bit later on in the broadcast, and plenty to talk to him about. We'll get a local perspective on things. Numbers have been really good the last couple of days. I think the number of deaths and new cases, we'll get those numbers for you in a couple of minutes, lower than ever. They continue to go down. We'll check in with Erik Wallis, the president of Henry Ford Hospital in West Bloomfield. Kurt Metzger joins us also. He is a mayor of Pleasant Ridge, and we'll talk about the census that he is very involved in. You're a state representative for many people tuning in. Representative Brenda Carter joining us on the show, and we're going to try to get a hold of one of our clerks, possibly Debbie Binder in West Bloomfield, and find out about this mailing that's going to be going out, essentially sending an absentee ballot to every voter, regardless of whether they request one or not. That's going to probably get a little political, but we'll stay out of the political fray and just report the news. We're going to take a really quick break. We'll be back in a moment, and we will check in with one of our finest law enforcement officials across Oakland County when the Megacast continues.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Good morning and welcome to the Megacast here on 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS, 89.5 Avondale Community Radio, and great television outlets including Civic Center TV in the West Bloomfield, Orchard Lake, Eagle Harbor, Sylvan Lake area, and of course Birmingham area municipal access in the Birmingham, Bingham Farms, Beverly Hills, and Franklin area. You can watch us online at civiccentertv.com, and also go today to the Walled Lake Consolidated School District's Facebook page. We'll be talking to Walled Lake fans. We'll be talking to Ken Gutman. I say that, Tyler, because so many people in Walled Lake tune into the Megacast, and we're on the Walled Lake page. We appreciate it. So we'll be doing that in just a couple of minutes. Right now, patiently waiting in a police department near you is our good friend, Administrative Lieutenant Erik Tilli of the West Bloomfield Police Department. Lieutenant, good morning and welcome to the Megacast.
Good morning, sir. Thanks for having me.
Sir, no one calls me sir. Thank you. I like that. Very kind. How are things at the WBPD going?
It's going very well. The officers are continuing to follow proper protocols. So far, we've had no positives in the department, so that's good.
And
with an abundance of caution.
Forgive me for interrupting. I apologize. And, in addition to you guys doing so well, isn't it reassuring to know that things are going much better in the community as well? The numbers continue to fall. The coronavirus numbers continue to fall as well.
That seems to be working out really well. We're tracking the numbers also with the Emergency Operations Center in conjunction with the fire department, and they're reporting the numbers are going down, so that's positive for us.
Very good. So, we're seeing this thing statewide, and I don't think it is an acute problem in West Bloomfield or any of our communities here. But, we're having more and more people exercise their own thinking that is contrary to the state law and keep hair salons and barbershops and other businesses open or opening other ones fresh. Have you seen anything like that going on in our backyard?
Fortunately, our citizens and our businesses have been following the executive orders by the governor, and things have been going very well in West Bloomfield Township. We haven't had no issues or complaints regarding that, and if we do have some sort of third-party complaint, usually we can mitigate that, speak with them, and they're more than happy to comply with, or maybe they just had a misunderstanding. It's been really, really good in West Bloomfield.
Well, it has, and that's not to say somebody might not pop up and just say, damn the torpedoes, full speed ahead, open up their business because they get frustrated or there's just economic concerns. But it's good that we have not seen that. I don't know that you're going to have a comment on this, but law enforcement in other communities, they've been reluctant to, sheriffs and other things have been reluctant to enforce some of these state orders. How did they make that decision? Isn't it the requirement of local law enforcement officials to enforce and implement any laws, federal, state, local?
I don't know that I can comment for what other agencies are doing, but I can speak for our agency when I say that because we have such great community involvement, really, it's just become that if there's any issues, we just simply explain the issues, explain the order, and request compliance, and we've had great success with that.
Well, and that doesn't surprise me, and that's been the history right here for the most part. And but I think part of that, too, is that we're moving along. I think if we run into a situation where this continues well beyond what the people in the community think is necessary, we might see a different a different result. And I think part of it, too, is our communities. We've all been able to stay connected really well, and I want to applaud the folks at the West Bloomfield Police Department for being a big part of that. What's it like for your officers on the front line? Now, are they answering a lot of questions, interacting with people quite a bit? Are people asking law enforcement questions about matters, things they can do, things they can't do, other related coronavirus questions?
Yeah, we faced a fair amount of questions. The officers are well informed, and so they're able to answer most of the questions. The deputy chief has also put out several videos and has done a fantastic job with the public information. Like I said, in conjunction with the fire department, there's a lot of public information going out on the township Facebook page and on the updated township website. So the information's out there. We educate and we direct them to where they can get more education.
Erica Jones has stepped in our studio from our team. She's been out in the field and reporting around our area. And I can let Erica speak for herself, but we've been finding that people are really doing a good job wearing their masks and doing all the things that they should be doing. Wouldn't you say, Erica?
Yeah, definitely. I really haven't seen any issues with people not wearing masks. One thing I have noticed, though, which I find interesting, is people are wearing them improperly, which I think is, key to mention, because we have had a lot of people on our show talk about that, how, it's so important to be wearing it properly. I'm seeing people all the time that have their mouth covered but not their nose, and I'm just like, oh, I wish I could say something to them, but not my place. But that's definitely one thing I've noticed. I think everyone needs a lesson on that.
Yeah, I imagine Erik, Tilli from the West Bloomfield Police Department, you probably see some of the same things. It gets a little uncomfortable, but for the most part, we see people are wearing their masks. What are you finding?
So we see that people are wearing their masks, and I think that's going to be one of the keys moving forward as we try to reopen society, is that if people can follow the proper precautions, wear their masks properly, keep their hands clean either by washing or alcohol-based products. If they can keep social distance, I mean, these are the same things we keep hearing over and over, because I think they're the keys to moving forward. And this isn't just my opinion. I think this is the opinion of the experts who tell us this is what we need to do in order to reopen society.
Finally, before we say so long, I just want to check in and understand how the first responders are doing. How, it's been a couple of months now, and first couple of days, we probably were, this is new and difficult, but now we're almost into 2 months of dealing with all this. How the officers handling it and holding up?
They're doing very well. I know everybody used the term the new normal, but it has kind of become that. The officers know to wash their hands all the time. When they come in the building, they go through a central checkpoint where they have a screening for various questions related to possible COVID exposures. They have their temperature taken. There's really no issues. Everybody understands the protocol. They're cleaning common touch areas. They're wearing their masks when they interact with the public. So, we've kind of adjusted it. Everyone seems like they're doing very fine with that.
All right, Lieutenant, thank you very much for joining us on the show. Anything else you want to add before we say so long?
No, I think it's just important for people to be safe and follow the protocols.
All right, well, thank you very much for your reminder on all fronts. Thank you for your service. Please extend our thanks to everyone in your department as we thank law enforcement all across our coverage area, and best to you. Thank you very much.
Thank you, sir.
Well, there you go. One of the guys in the front line, that is Administrative Lieutenant Erik Tilli of the West Bloomfield Police Department, here, at least in our area, saying that we've not had to, enforce any serious situations of people opening their business in advance of the orders. Now, things are going to get a little bit more interesting and a little bit more challenging as we begin to open up restaurants and bars and other retail establishments. But, Erica, from your visit the other day over to Kroger when we were live on the air, people are doing their thing. So I don't see
Morning,
why,
Ken. How are you?
being optimistic, I don't see why we won't have a positive experience with the opening of the rest of our economy.
Yeah, I mean, like I said, everyone was very socially distanced when I went to Kroger, and it just, not even so much that they were socially distanced, the store in general just didn't have that many people in it. And my honest opinion is that I think even when the economy, or not just the economy, just, West Bloomfield and Oakland County does open up, I think it'll be less of an issue with social distancing, because regardless of whether it's open or not, I still think not as many people are going to go out in public, even when they have the opportunity to, because there are still going to be so many hesitant people. So there will just be, less numbers in these public places.
Well said, and we're seeing that as people, even as the economy opens up and restaurants open and retail establishments open up, people may still be a little reluctant to get out at first as they are concerned for their own health. So we'll keep an eye on that. He is the superintendent of the Walled Lake Consolidated School District. It's Kenneth Gutman. We're going to get to him in just a moment. We're going to take a quick break, and we'll be right back. Also coming up on the Megacast, we have 10 tips. This is going to be helpful for you, I think, today. 10 tips that your business must know, and things you have to do according to the governor's orders before you open up your business. So if you are going to follow the footsteps of manufacturing and the restaurants in northern Michigan, maybe you've got a hair salon or a nail salon or a retail establishment that isn't quite open yet, but you're getting ready to open in the coming weeks as things hopefully loosen up in your neighborhood, in our neighborhood. How do you do it? What do you execute? What are the 10 things you need to know? We'll get to that in a couple of minutes. Good morning. This is the Megacast, and we'll be right back.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Good morning and welcome back to the Megacast. Dave Scott and now with Erica Jones in our Lakes FM studios in West Bloomfield. Thanking you for tuning in wherever you happen to be today. 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio, Civic Center TV, Birmingham Television, and most importantly, the place where millions of people gather every time Ken Gutman is on the show, the Walled Lake Consolidated School District Facebook page. Joining us now, the Superintendent of Schools, Kenneth Gutman. Good morning, sir. Welcome back to the show.
Good morning. How are you?
I'm fantastic. How you doing today?
I'm fantastic as well.
Good, good. Thank you for joining us. You guys are right in the crosshairs of the state budget. When I say you guys, I mean education around the state of Michigan. So let's get right to it. I've heard that numbers may be anywhere from $500 a student up to $2,500 a student as we're working on getting a state budget that works. What are you hearing? What are your thoughts? What kind of plans are happening in Walled Lake?
Yeah, we're hearing the same thing you are, Dave. And I can tell you that if we were even to look at $500 per student, we're looking at a $10.6 million reduction in Walled Lake schools. That's crazy. I look back to 2011 when we cut $470 per student. This year was the first year we were going to pass what we had previously received in 2011. It would be a huge step back for us to even receive a $500 per pupil reduction.
So given that, and I have a note here, it says the latest budget planning from the state of Michigan says maybe $600 per student. We don't know that. I mean, we have no idea what dollars are going to be available, but that's what they're working towards. I mean, you got as unfortunate and miserable as it is, it's kind of like, you know, my mom made me eat those green beans. I hated it, but I knew I had to. You got some green beans on your plate, my friend, right now. And so are you working on a plan, or what are we going to do?
We are. Unfortunately, our plan includes sweeping reductions, layoffs, and that sort of thing. 85% of our budget is staff. And that's the terrible, most terrible part is we end up at a time where we know more about how to teach. We need more restrictions potentially when we open in the fall, and we could potentially have fewer staff to work with the issues we'll have. So we'll eat the green beans and we'll make it work for our kids. It just will obviously not be optimal.
All right. Well, sorry to get our interview off to such a, a difficult start. Just the reality we're going to have to deal with. Is there a safety net out there? Is there, are there conversations? You're closer to this than I am. Are there conversations of somebody, the federal government, some other pile of money coming from somewhere to help out?
That's what we hope to see happen. I think short of a federal stimulus package, we're in a lot of trouble. And that's not just us. I mean, you look at districts with very little fund balance, this could bankrupt a number of districts around the state. And so if we really would love to see people advocating for federal stimulus money. Even Senator Shirkey came out yesterday and said, look, we need to do this. We need to not cut education budgets. Think about the implications of just social distancing. Think about that, and think about having potentially more students in a classroom because you have fewer staff. That's a little upsetting. And so we hope to be able to, we hope that our advocacy at the federal level is successful.
And do you feel, Ken Gutman, superintendent at Walled Lake Schools, do you feel that education is getting its fair share from the state of Michigan? I mean, everyone's got to tighten their belt. It's going to impact other areas of the state budget. Are we far enough down the road where we even know what that looks like and whether it be appropriate for school districts to lobby for more of the dwindling state dollars?
We're not unrealistic. We understand there's no money out there right now, at least at the state level. From my perspective, though, if I don't advocate for our children, I shouldn't be doing this job. And frankly, our children deserve better than we'll be able to give them next year if we don't receive some help from the federal government.
All right. Well, you never know, too. In some communities, I don't know if it's going to work in Walled Lake, but in some communities, it may be necessary to go to the business community and the philanthropic community to see if there are some dollars out there. I mean, it would be hard to replace that, $10 million number you were talking about. But are there discussions in some communities around the state and maybe even Walled Lake about looking for some other philanthropic sources of money?
There are certainly those discussions taking place. It's a hard time for everyone, though, and I don't know how much philanthropic money there is when there are so many people. Let's be honest, we have people dying, we have people who are ill. There are a lot of needs, and we have bankruptcies, we have people losing their homes potentially, we have businesses potentially going under. It's a rough time for everyone. So certainly I will advocate for education, understanding that this is a tough time for our entire community and the communities around us.
All right, Ken Gutman, superintendent of the Walled Lake Consolidated Schools. Isn't it fun coming on this show?
I love this show, Dave. I hope we can keep doing this next year.
Yeah, no, this is work. I mean, I appreciate you being good-spirited when we are having these difficult conversations. It isn't easy. How's graduation planning coming? I know that's another tough one, too.
So I take a deep sigh. So it's coming along well. We've actually rescheduled our graduations. We were supposed to do all 3 high school graduations on the 31st, May 31st coming up, and obviously those won't happen. So we've looked at rescheduling them, 1 on July 31st and 2 on August 2nd. The reason to not be able to do them all in one day is we do these at Eastern Michigan University, and they like us to space these out more to allow for proper cleaning, including every seat in the stadium prior to us having these ceremonies. Now, will these ceremonies even be permissible by July 31st or August 2nd? Who knows? And so we're not even sure if those will take place, but we certainly want to keep those on our calendar. We also have some other events planned, if you don't mind, Dave, for our seniors. We're going to do a virtual senior honors recognition on May 22nd. We're going to do a legacy scholarship virtual recognition on May 28th. We're going to do senior celebrations on Sunday, June 14th. And I can tell you that our principals right now are in a meeting finalizing details for that, for cap and gown distribution and all of those types of things. What saddens me is that this is not the senior year our seniors wanted. We all know the rites of passage that come with a senior year. And they'll have a story, but they won't have the same memories as the rest of us had of that year.
Well, I don't know. When I think back of my graduation and my senior year in high school and, the coming of age that represents and the transition to college life and getting on with the rest of your life, all those things are still there. So I think, for students that are going through this right now, don't be dismayed. Parents, don't be dismayed. All that's going to continue to happen. And I know that you, and I believe me, I'm talking to a lot of the school districts in our area, and I know that that you guys are going to find a really unique, creative way to recognize them. And, even though it was one of the darkest moments in our past, I do remember baseball in 1967, and then right after that, the World Series in 1968. So those are some really tough years, but you remember them, and you become stronger because of them. So I don't want to go on. This isn't about me, but I'm just hoping that's where this all ends up.
And that's what I tell my son, who's a high school senior. Look, this won't define your life, but it will make you stronger. And there will be other opportunities to celebrate you. The other thing is, I hope you're guaranteeing the Tigers win the series then next year based on your announcement.
It's an absolute, I got it right from my friend Dan Dickerson. He said, as soon as we get baseball going, it's going to be a complete 100% turnaround. So, yeah, it wouldn't be. Yeah, but, again, it's like everything else. We just don't know if the stadiums are going to fill up. You don't know whether you could be at Eastern Michigan. We can only plan. We can hope, but we just got to, keep working on our plans, and everything will be fine. So schools are wrapping up. So can you talk a little bit about your schedule? And by the way, for folks listening, virtually everything that's going on in Walled Lake, something similar is going on in your district. So if you're listening right now and your kids don't go to Walled Lake schools, maybe they go to Bloomfield Hills or Avondale or one of the other, Troy or one of the other districts. A lot of the same kind of planning is going on everywhere else. But Ken Gutman, we're talking about Walled Lake right now. So talk a little bit about what your schedule is like as we come to the end of the school year, what students will be doing during the summer, and if you'd like to transition into the fall, some thoughts about the fall as well.
Sure. So my schedule is jam-packed, as it always is. It's just different. It's all done virtually. It's Zoom meetings for 8-10 hours a day, as opposed to visiting schools and seeing children and being in other meetings and getting a chance to spend time with staff. So the fun parts of the job aren't there. It's being around students and staff and parents and celebrating education. But we're continuing to work hard and prepare our children, and albeit not as to the same degree we would like to. The fall's a different story. And so the fall is yet to be determined. We know that the governor is convening a council of people to make recommendations as to how best to reopen schools in the fall. And so we haven't made a determination because we're waiting for what the governor says, but we're looking at all kinds of options. Ideally, we open the way we used to. And I know perhaps that's a Pollyanna approach. We open the doors, we have our children there, we follow proper guidelines, and we're face-to-face instruction. That's the ideal. However, we have to look at a blended approach. Are some of the days in person, some of the days online? Are we looking at potentially doing different configurations where we're doing fully online for a while? I hope not, but we're considering all of that and trying to get prepared for whatever the governor's group recommends, because we want to make sure we take care of our children. There's a lot of learning loss that takes place over the summer. And unfortunately, we believe there's been some learning loss this spring as well.
All right. Well, we all have our hands full. We look forward to what Lansing has to say about it and how you and our other superintendents around the area figure out how to implement it. And we'll go from there. Ken Gutman, thank you very much for joining us, Superintendent, Walled Lake Consolidated Schools. Anything else you want to add before we say so long?
In spite of all of this other misery, we're going to continue to take care of every child every day in Walled Lake. And I appreciate the opportunity to spend time with you.
All right. Thank you very much. It's always a pleasure. Thank you very much. And a huge thank you to the entire Walled Lake community who is so enthusiastic about your schools. And we also appreciate the enthusiasm over our broadcast and the participation. So thank you very much, Ken. Good to talk to you.
Thank you.
We're going to take a break. We'll be right back. We're going to check in with one of our local mayors. It is Erin Lorenz, the mayor of Sylvan Lake. He will be with us in just a moment when the Megacast returns.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
Welcome back to the Megacast. Dave Scott here on Lakes FM in West Bloomfield. The Biff in the Bloomfield Hills area. 89.5 Avondale Community Radio in the Auburn Hills area. And all these signals go well beyond, of course. Thank you for watching today on Birmingham Area Municipal Access. Thank you for tuning in on Lakes FM and Civic Center TV. And you can always go, if you want to watch us on cable and you are an AT&T subscriber, we invite you to go to Channel 99. You'll find the municipal area there. Go right in there, and you should have no problem at all just clicking on one of our communities and seeing our show. Simplest way to do it, just go to the web, civiccentertv.com, and you can watch us in full high definition. And today, of course, thanks to the Walled Lake Consolidated Schools and their Facebook page. So as the Oakland County Executive Dave Coulter said in our last public service announcement, census is coming, so we're going to talk a little bit about the census a little later on the show and see what you should be doing if you haven't, and just check in. I mean, everything is more difficult right now during this coronavirus COVID-19 challenge, including getting the census done. Kurt Metzger will check in. He's the mayor of Pleasant Ridge and a former Census Bureau employee. Also checking in later on the show, State Representative Brenda Carter of the 29th District. We're going to talk to Debbie Binder, the clerk in West Bloomfield, because we just found out hours ago that the ballots for the next two elections will be actually mailed to every person here in the state of Michigan. And we'll check in on the health front with Erik Wallis, the president of Henry Ford Hospital out in West Bloomfield. Right now, though, talking about mayors, let's check in with one of our favorite mayors. And, you know, he's not the mayor of the biggest city, but he's, and I think one of the mayors with the biggest hearts here in our area. It's Erin Lorenz of the city of Sylvan Lake. I hope that didn't sound too cheesy, Mayor Lorenz. I don't know, just kind of came up. That's how I'm feeling today. How you doing?
I'm doing great, and I appreciate the compliment, and thank you to you guys and your team for the great work that you do. Well,
you're very kind. I always like to ask everybody when we see them on Zoom in their home where they're sitting, how's it going, and you've been in your home for almost 2 months now. So how are things in the Lorenz house?
Well, you know, it's amazingly productive. You know, my daughter came back from veterinarian school and has been working online, and we're able to handle most of the business that we need to handle online. I do deal with some essential customers that produce parts for the Department of Defense, and I've had to go out and help with some technical issues at some customers. So I have gone out and followed the precautions of safe distancing and wearing a mask, and you know, getting used to the new challenges that we're all going to be facing as we go back to what is typically referred to as the new normal.
Well, that's interesting you mentioned that. I hope you don't mind if I ask you a question about that, and then we'll get an update on how things are going in Sylvan Lake. So in your day job, if you will, you do work with manufacturers, if I am correct. So have you had a chance to be in some of the newly opened manufacturing facilities around our area?
Yes, I've been to one actually a couple of days ago that was starting up some equipment, and they had done a lot of modifications. And, you know, like all things, when you put something in bed for a while and when you get it out and start it back up, it doesn't always go so quickly. So I did get to see their startups. They're starting up one shift 5 or 6 days a week. They used to run 3 shifts. So right now they're running basically planning on starting out running at a third capacity. And what we're going to see is where this goes after automotive, you know, picks up and starts up. And obviously all of us who are in the manufacturing side of the business are hoping everybody runs out and buys a new car with the money that they got from the stimulus package, so that, you know, we keep our manufacturing people at work and making money on the front lines. to
Well, I
stimulate
hope
our
so
economy.
too, and whether you like or dislike the President of the United States, it is kind of cool that he's going to be here on Thursday and in one of the Ford plants where we were able to pivot. I mean, it's right here in our hometown in Metro Detroit. We have folks that have been working really hard, UAW workers working really hard, and able to make the vents that we needed to get cranked out really quick, and we're going to be celebrating that, and that on Thursday when the president comes, and just manufacturing ramping back up. And I don't know, Mayor Lorenz, whether you saw the reports on TV, but I was really impressed yesterday with what I saw at the automotive plants as they were opening up, the checkpoints they had set up, the technology. I mean, in my office, I've got the head scanner like we all have, but they had some really amazing technology they were showing on TV where people could walk in front of a thermal imaging camera and it could take a look at their temperature. And so it's really amazing the way people have shifted and adjusted, and I think we can all be proud of that as we try to keep things under control here in this new era.
Yep, it's going to be interesting, and like we've always done in the past, we will adapt and we will embrace the new technology and the new normal, and we will advance through it.
How are things going in Sylvan Lake? Let's get I appreciate you engaging me in a little conversation on manufacturing as we sidebar, but how are things going in Sylvan Lake, Mayor Lorenz?
Things are going great here in Sylvan Lake. Unfortunately, the weather for the last couple of weeks hasn't been all that great, but we did have a nice weekend a couple of weeks ago. And, I was down at the beach and checked out how we're doing at the beach. And it was nice to see that people were practicing social distancing and, being safe around each other. And, there's a lot more people walking around the neighborhood and, just getting out and about. So this is a really good to see the people enjoying the great outdoors. Yesterday I was on a webinar with the Treasury Department of Michigan talking about revenue sharing in the state and how the coronavirus shutdown might be affecting the budgets going forward. There's a lot of speculation and a lot of models, and we'll see who's right in the end about where we end up as far as revenue sharing with the state of Michigan going forward.
So,
that's
Mayor,
our biggest concern.
Mayor, let's talk a little bit about that from a money standpoint for our communities. So, and we just talked to Ken Gutman at Walled Lake Schools. They're expecting a really big reduction in the amount of money the schools are going to get. Municipalities, aren't they primarily funded with property tax dollars? So with that, how does a reduction in state revenue impact what local municipalities get?
Well, there's a few areas that we're getting money from the state from. There's the state's revenue sharing to the cities, and then there's local and there's the local road funds that we get from the state. And these are, for a city of our size, every dollar is significant, and you hate to see any of these dollars disappear, even if it's 10%. So we're basing our budget on what was projected, currently, and we'll see what happens going forward, and we will adjust as necessary.
All right, well, good luck. It isn't going to be easy. Everyone's got a much smaller pot of money to work with. Any other significant projects coming up in the community that over the next year or two that you think might be affected by all of this, or are things pretty much, at least as they stand now, continuing to progress as expected?
Well, we have the vacant Whitfield School property that is currently being evaluated for possible rezoning to C2, which is commercial. And part of the idea was that the developer wanted to have it rezoned so that they could put office space in there. And, as we've all experienced now, a lot of people who have been working in offices haven't been working in their offices for the last 8 weeks. And this was a trend that had started long before this, where people were working remotely. And I think, what's going to be interesting going forward is how the new normal affects real estate, because are all the people that were working out of the office going to go back to the office, Or are these companies going to right size, so to speak, and say, okay, we don't need to have 100% of our people in the office. We can have 50% of the people, working remotely, which means all the office space that was filled might become vacant. So this is going to be interesting to see how this affects, development going forward. Are we going to see office buildings built at the rate that we were seeing them? And what happens to reutilize these spaces that might be open?
Yeah, it's so great that you mentioned. I appreciate you bringing that up, Mayor Lorenz, because I was thinking about the same exact thing the other day. We all want to see the economy come back in that V, right? It went down. We want it to come right back up. But you start thinking about this new normal, people working at home exactly the way you said, and then what are we going to do with all those office buildings? Can they convert? Because what we're going to have on the upside, I think we're going to have a real need for a lot more residential because people are going to be working at home. They're going to want a little bit more space. I wonder if some really creative entrepreneur is going to come up with a way to convert some of these big suburban office buildings into residential units. I don't know if it could even be done with zoning, but, someone's going to figure that one out. That'll be a really good challenge.
Sure. What was really positive about the Treasury Department's presentation yesterday was the projections for growth in 2021 and 2022, where they were talking getting back to normal as far as our growth in GDP. So it was a rather positive message that was put out to us.
Well, I appreciate you sharing that with us. Good to talk to you. On one other note, and I don't know what's happening in every community around our Oakland County service area, but I do know that Sylvan Lake will not be having a Memorial Day parade this weekend, and neither will your neighbor. And Civic Center TV has broadcast these parades in the past, so if you don't mind, Mayor Lorenz, my good friend Erica Jones, sitting right next to me in the studio, is going to take tapes of your parades in the last couple of years. And last year, I was happy to be there in person myself in Sylvan Lake. So we're going to take those parades and some other parades, and we're going to put them all together, and we're going to broadcast them on Civic Center TV on Memorial Day. Will that be okay?
Oh, I greatly appreciate that. And as a matter of fact, we are putting some clips on the Sylvan Lake website, and I was indeed going to call you later on today or send you a message and ask you if you would be so kind to replay some of the past Memorial Day parades to honor our fallen heroes who have brought us the freedom that we so greatly enjoy here in the United States.
Well, we're right, and great minds think alike, if I can humbly say that. So we're working on that. And Erica, you all ready to put all that together for us in the next couple of days, and then you're going to host that on Civic Center TV, right?
Definitely.
All right, I got to get your mic on. She said yes?
Yes, definitely.
All right.
Looking forward to it.
All right, Mayor, so we're in good hands. So Erica will put all that together, and folks, we invite you to tune in on Memorial Day and certainly honor those. It's going to be kind of tough because, our coverage aside, it's really wonderful to Memorial Day gather and hear from and see those that have served our country. We're not really going to be able to do that the way we have, so we'll do the best we can to make it happen virtually.
Great.
All right, Mayor, thank you very much. I appreciate your time today, and we will be talking very soon. Good to have you with us.
I hope so. Have a great day. Thank you to you and your team.
Very good. He is the mayor of Sylvan Lake. It's fun to talk to Erin Lorenz because we, as we did today, usually go off in a couple of different directions. So that is great. Glad to hear things are going as well as they can right now in Sylvan Lake. We're going to take a break. We'll be back in a moment. Coming up in a few minutes, we're going to run down the 10 things you need to know if you are getting ready to open your business or just have. So we'll run that down for you. Later on in the program, we're going to talk to our clerk in West Bloomfield, Debbie Binder, who will talk about the new mailings that are going to be going out to everyone. Word out just maybe an hour ago that the state is going to mail a ballot to everybody for the upcoming May and November elections. So big news there. We'll figure out how all that's going to work. And ahead of schedule and already in the queue is Erik Wallis, the president of Henry Ford Hospital, West Bloomfield. So we'll get to him in just a couple of moments. It's the Megacast, and we will be right back.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. please stay home. And when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
The Centers for Disease Control and Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Thank you very much for joining us on the Megacast. It's not television or radio or a podcast or even a Facebook live stream. It's not even a Zoom meeting. There's sure a lot of those out there right now, but it's the Megacast. It's really almost all the above. Radio, 89.3 Lakes FM, 88.1 WBFH The Biff, 89.5 Avondale Community Radio. TV, Civic Center TV, West Bloomfield, Keagle Harbor, Sylvan Lake, Orchard Lake, Birmingham Area Municipal Access. In Birmingham, Bingham Farms, Beverly Hills, and Franklin. We are on Facebook today. Thank you, Walled Lake, the Walled Lake Consolidated School District page, and on our Civic Center TV live stream at civiccentertv.com. I thought we were on Zoom today, Tyler, but I don't see the Zoom button here yet. So we'll add the Zoom in the Megacast maybe tomorrow.
Sure.
Oh, actually, we are on Zoom because look at this. Look at this. There's Erik Wallis. He is the president. Forgive me, Erik Wallis. He is the president of Henry Ford Hospital, West Bloomfield. There's just so many gadgets around here, Erik. I don't even know which way to go sometimes. I get confused.
It sounds like you need more technology.
Yes, exactly. Well, you live in a world of advanced technology, so you kind of understand. Again, Erik Wallis, President, Henry Ford Hospital, West Bloomfield. Erik, let's just start with the good news today. The numbers continue to come down, and yesterday we got the lowest death number, and I think maybe even the lowest additional new cases of coronavirus in the state, if I'm correct. What are your thoughts?
No, absolutely. I think you point out the important part of that is that we're seeing fewer people pass away from COVID-19, and a lot of hard work and unfortunately, a lot of pain that folks and businesses have been dealing with have worked. They have really kind of flattened that curve out so that we have the resources to deal with folks who are sick and need to come in. And we've learned a lot about the virus over the last couple of months and how to treat patients and how to get them well and get them back out of the hospital.
One of the things that, and I don't want to create any controversy here, but one of the things that has been unfortunate, you're smiling, don't worry, this is going to be an easy question. One of the things that has been a little bit more of a challenge, and I think we're realizing even more now, and you got to learn some of these things, right? We're realizing even more now in the nursing home settings that it's been very difficult mixing COVID-19 patients and non-COVID-19 patients, and it's been a problem in the nursing homes. Can you talk about what's been happening in the hospitals and why it's not been as much of a problem in the hospitals, or maybe it has and we're not aware of it?
No, I think, what you're talking about are two very different venues, and the advantage that we have here in the hospital is that we're used to dealing with really acute issues and acute disease. And I think for a hospital like West Bloomfield, we were always very fortunate that every one of our patient rooms is designed to be private And so, we have the ability to have folks in a private space, close the door, and put some of those isolation protections in place. Every facility, even throughout the Henry Ford system, has had to deal with different challenges based on the physical layout and design of the building. And so from that standpoint, I feel extremely fortunate to be here at Henry Ford West Bloomfield, because we are set up with all private rooms, and it makes it a little easier for us to isolate and manage folks.
So I appreciate your thoughts on that. And, we have to deal with what we have to deal with from a physical standpoint. But I'm sure in the hospital setting, too, you and your team and the healthcare industry as a whole, you've learned some things that have helped you deal with this crisis better as you got deeper into it. I mean, don't you think? Do you want to talk about that?
Yeah, no, absolutely. And I think, some of what you've seen is, we're blessed to be part of a large healthcare system that has, great ties and connections to experts all over the world. And so whether it's, Dr. Betty Chu and Dr. Steve Kalkanis, Wright Lassiter, Bob Riney, folks being in daily communication with the governor's office, with the CDC, John Hopkins, folks, we've been able to reach out and pick their brains and their expertise. And frankly, we've had folks from around the country that have called us to say, how are you guys dealing with this? Because you're right in the thick of it. So I do think that's one of the big advantages to being part of the Henry Ford healthcare system, is that we've got these connections. We've got, folks that we can reach out to and brainstorm with. And frankly, you're even seeing us, kind of lead the way in some things, like some of our clinical trials and studies that we're involved with to help figure out how do we keep, first responders safe with our WIP-19 study. Or whether it's looking at things like the use of remdesivir and how does that affect the treatment of these COVID-19 patients. So it's really, I said, it's a blessing to be part of the Henry Ford healthcare system.
So do you want to talk a little bit about those studies? What have you been learning about remdesivir and what's going on with treatment surrounding that drug?
Yeah, so I think, our main hospital downtown, the Henry Ford Hospital, has been one of the clinical sites across the country that is part of that larger scale clinical trial to look at remdesivir and how does it improve or impact the treatment of those patients. So it's going to be a little while before we get all of the results. I think it would be premature to say, hey, we've seen it in X number of patients. Part of having a randomized controlled trial is actually taking the time to look at a large sample of patients to make sure that there aren't effects out there that people weren't expecting. I think you've seen that with some other drugs that have been talked about or potentially put out there for the treatment of COVID-19 that, once you start doing some of these trials, we kind of go, that doesn't seem like it works as well as we thought it might. And so we're trying to be, scientific, thoughtful, planned about how we go through those trials. The other one that I mentioned is the WIP-19 trial that is being done right now with hydroxychloroquine and seeing does it help our first responders prevent them from getting COVID-19. So that's a trial of about 3,000 individuals that are going to be taking place in that. And so again, as we work through that, we're hoping to see results and see whether that's a worthwhile preventative for first responders or not.
Yeah, well, it's good to see that study is going on, because with all of these drugs, the media does what the media does, jumps to conclusions one way or another on the effectiveness of these drugs, because that's the way we are. We want an answer immediately, right? Mm-hmm. And a story. So, it's good to hear. And that I love doing this show because I hear from people like you, and we find out what is really going on. So both of those research projects are happening. We can be really happy to know, just to recap, that a big part of them is happening right here in our backyard with you at Henry Ford. And we don't know yet. We'll wait and see and get some real information. So
absolutely.
I appreciate the updates on that. Seems like testing is getting better, and we have more testing. And I know you've been doing testing there throughout, but we have a lot more facilities now where you can go get tested. And even watching the coverage of the opening of the auto plants yesterday, I saw that they're even doing some on-site testing. So, Erik Wallis, president of Henry Ford West Bloomfield Hospital, what can you tell us about where we're at with testing right now?
Yeah, I think we're partnered again very closely with the state of Michigan and the Michigan Health Department I think there's various versions of it. So again, anybody who has symptoms, thinks that they've been exposed, there is the opportunity to get tested in a number of ways. The health system, we've really focused on having folks that if you're not feeling well, if you feel like you've been exposed, we want you to have a conversation with your healthcare provider to kind of have that initial screening, and then they can send you to one of our testing locations. Our ambulatory sites have stood up kind of multiple places, whether it's over here in Bloomfield Township, our place over at the Columbus Center, are places where folks with a provider order can come and be tested. Certainly, if you're feeling very ill, we don't want you to wait. You're more than welcome. We want you to come to the emergency department here, and we can take you right in and get you evaluated and make sure that you're safe. And then, certainly with the local county, state health departments, there are places where you can go and be screened. And again, most of those, they want you to call ahead and have a conversation so that they know you're coming and make sure that it's appropriate to test you.
Yeah, and that seems to be consistent. But if you really need to get a test, you definitely can get it. That's the good news. And if you got a doctor, call your doctor. If you don't have a doctor, at least call, as you said, Erik Wallis, and you'll get your test. And I see that we're doing both of the tests, a test for the antibodies and the test to see if you are currently infected. Erik Wallis, President at Henry Ford Hospital, West Bloomfield. I want to ask you about vaccines here, but I have to keep all of our radio stations legal, so we need to say that we are on the air in WAHS Auburn Hills, WBFH Bloomfield Hills, and WBLD Orchard Lake. The stock market goes crazy the last couple of days, yesterday in particular, on news that we may in fact have a vaccine. The national news yesterday said that the vaccine that we have is effectively producing antibodies. And I know you're not a doc, but you're the closest I got to a medical person today. But it's producing antibodies, and it is not having any detrimental impact on the very limited number of people. Are the docs around your building pretty excited about that?
Yeah, I think, again, it's one of those things that we want to be cautious. There are a number of folks right now that are working on possible vaccines. I think what's really cool in the time that we live is that there's a lot of new technology, and so some of the traditional ways that vaccines have been developed are still out there, but there's also some really more genetic and molecular kind of things that are going on that have the potential to potentially move a vaccine along a little more quickly. But again, it's like anything else, and even the studies that we talked about, we really want to see more than just a very small scale trial. We really want to see larger scale testing of these things to make sure that they're safe. Always excited about the fact that we might be closer than we hoped, but we want to make sure that what we're giving to folks isn't going to cause them any harm either. And so I'll leave a lot of that to the FDA and others to figure out how quickly they can safely move through that process. But I think that they've got years and years and years of expertise in knowing when it's the right time to move to the next stage of testing, and when it's ready and able to be given out, we're going to be here and make sure that we're a trusted partner for the community and make sure that you can get the vaccine when it's available.
It's going to be fascinating, Erik Wallis, to see as these tests go on how quickly they can ramp up the vaccine and then how quickly we can manufacture. What a great test for our society and our technological skills right now to see how quickly this can happen. We're all excited. The stock market was excited. We're excited. We'll keep our fingers crossed, and hopefully the continued testing will move along. So, I know it's impolite, and I don't want to be impolite, but I was always taught it's impolite to ask somebody about money. But I can't resist. I'm just, we hear reports that hospitals are having a hard time right now because the elective surgeries that you depend on for your financial wherewithal you've not been able to implement. So in the interest of being, well, try not to be impolite, but how you doing?
Yeah, no, and I think it's a fair question, and you've seen a lot of stuff out in the news media. I think that our reality is, you're right. What we have struggled with is that based on the financial mechanisms of healthcare in our country today, a lot of our income is derived by elective procedures. And, not having been able to do those now for going on 10 weeks has been a huge financial hardship. So, in some respects, we've seen as much as 50-60% of our revenue disappear. And so it's something that we're working again very closely with the state and the governor's office to try to figure out when is it safe and appropriate to get back to allowing folks to have those procedures. Today, we are working through starting to bring back what we call time-sensitive things. And I appreciate that the governor's office, not too long ago clarified that the people that really should determine whether something needs to be done or not is the patient and their doctor. And so we have seen a return of some of those procedures that are more time-sensitive, things that if people don't get them done, that could cause longer-term harm. And so we are starting to ramp those back up. We're doing a lot of measures to keep people safe as they do come into the hospital. And so, for our new moms who are going to be delivering or patients who are coming in for some of those time-sensitive tests, we are screening those folks, testing those folks before they come in to have their procedure to make sure we kind of know their status and help them to feel safe in our environment.
Well, I appreciate your update, and I think people do feel safe. They just can't wait forever if they need a cancer therapy or they're having a baby. I mean, these things are going to happen, right? So, good to hear that you're able to keep the coronavirus in one wing and this in another wing, or however you're doing it. So thank you very much for that update. And again, people should feel safe coming to Henry Ford Hospital if they have to come with a non-coronavirus issue, correct?
Absolutely. And I would say even over the last couple of weeks, that if you come into our emergency department, 80 to 90% of the people come into our emergency department are coming for non-COVID reasons. And so it has, again, it's greatly declined within the community. And at this point, we've had a lot of experience on how to keep folks safe if they are here for a COVID reason. And we've got a lot of experience in how to keep people safe if they're coming for other reasons. So the one thing that we want to continue to hammer home is please do not wait. If you're having an issue, we're here, we're safe, and we want to take care of you. Unfortunately, and I think some of our EMS partners would tell you that we've seen way too many people who are having significant events at home because of their fear, and there's no reason to be afraid. We've got this, and we can keep you safe.
Erik Wallis, thank you very much. President, Henry Ford Hospital, West Bloomfield. Extend our thanks, our sincere thanks to all the amazing people in your building and everyone in your industry been on the front line of this, literally putting their lives at risk in this war against COVID-19. We appreciate it, and we need to have another one of those big parties in your parking lot, like we had not too long ago, and I'm sure the day will come. It will come. So thank you very much.
Absolutely, Dave. And I'd be remiss if I didn't say, happy EMS week to all of our EMS partners out there. If you get a chance, make sure you thank those guys. They're doing the hard work out in the field.
I didn't know it was EMS week. I appreciate you mentioning that. Tyler, happy EMS. We got to call all the EMS guys. And all right, very good. Thank you, Erik. Appreciate it. Erik Wallis, he is the president of Henry Ford Hospital, West Bloomfield. We're going to take a break in a minute. We will check in on the census and talk to Kurt Metzger, mayor of Pleasant Ridge, and a former census employee, and find out how things are going there. We understand that ballots are going to be mailed to every citizen in the state of Michigan for the upcoming elections. One of our area clerks, Debbie Binder, joins us. State Representative Brenda Carter will check in the next little bit. And Tyler, if you would hang in here with me for just a moment. Right after this break, we are going to run down the 10 things your business needs to know if they're getting ready to reopen. It's the Megacast, and we will be right back.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, Our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
And welcome back. It is the Megacast on 3 great radio stations around Oakland County. 88.1 WBFH, the Biff. Thanks to Ron Whittable. He's still doing that himself every single day. Tyler Keefe getting us on the air and doing it. That's amazing. Awesome. It's been 2 months. And then Logan at WAHS 89.5 Avondale Community Radio doing the same thing. Wouldn't be on the air without the commitment of these guys. We really appreciate them and their communities and school districts for allowing us to use the radio stations for this noble cause. 89.3 Lakes FM, of course, the studios where we are at every day. Civic Center TV, BAMA, Birmingham Area Municipal Access, and of course you can watch on Channel 15 on Comcast. And if you are an AT&T subscriber, no matter where you are, go to the Channel 99, the municipal channel, and you will find us. And also, no matter where you are, go to civiccentertv.com, and you will find our live stream today in the Facebook area. Oh, yes, Walled Lake Consolidated Schools. We are on Facebook Live there, so we thank everyone in that area for tuning in. Kurt Metzger is the mayor of Pleasant Ridge, and he knows everything there is to know about the census. He is a former Census Bureau employee. We'll talk to him in a couple of minutes. Very quickly, before we get to Mr. Metzger, Tyler Keefe, there you are. From the executive order that came out yesterday, with all the information about opening up the restaurants and the bars in northern Michigan, were some other pieces of information. And I thought we would just take just a brief minute to rip through those. But first of all, that was a big surprise yesterday. Restaurants and bars opened up in northern Michigan and the UP, a perfect timing right before the big Memorial Day weekend. And you're supposed to stay at home, but I think some people are going to head up north.
Yeah, I think that's naturally going to be what happens. Some people will flock up north to their second homes or go camping or just to go into the bars and to the restaurants because they're stir crazy. Even though that's being discouraged for public health reasons, it's definitely going to happen.
So, and then there are rules to all this. You can't just open up your bar or restaurant. In the Executive Order 91 on the state's website are all the rules that the restaurants and bars must adhere to. And then there are rules there for other businesses. So if you have not yet opened your business and are getting ready to open your business, here are the top 10 things you need to know. I wish I had like the David Letterman sound effects from Letterman's Top 10, but this is serious stuff here. Number 1, businesses need to provide training workplace infection control practices, reporting unsafe conditions, and how to properly use PPE and steps. So it means you got to have a little handbook with all the instructions, right?
Yeah, you need to have a handbook with instructions. You need to have what to do in this situation or in that situation, who to report to if something isn't right in the situation. Businesses
must have protocols in place for cleaning and disinfecting the workplace we do every day with our Clorox disinfectant wipes. And believe me, that's just the studio. We have a lot more cleaning going on here. But you got to have a cleaning policy. You got to have a cleaning policy. They also must make cleaning supplies available to all employees, just to show that we're in compliance. There you go, Tyler. Your cleaning supplies. When an employee tests positive for COVID-19, the employer is required to contact the local health department and any coworkers, contractors, or suppliers, so that way they can do contact tracing. If you know someone that is tested positive, you got to send out the email. All employees or contractors entering a workplace are required to go through a daily self-screening. So over at our offices, we've got a little cart with a checklist, and it asks all the questions. There's the thermometer. You do all that. Employers must provide non-medical grade masks to all employees. Surgical and N95 masks are only supposed to be used for the people that need them. Doesn't that get you Doesn't that get the hair up in the back of your neck when you're at the grocery store and you see someone wearing an N95 mask?
It does a little bit. Maybe they are a frontline worker. I think maybe they are a frontline worker. Maybe they are a first responder. And so I try to give them benefit of the doubt, but at the same time, you just don't know, and it just gets you a little bit irked.
Employers are required to encourage employees to wear gloves, masks, and use hand sanitizer when using public transportation to get to work. So, I drive my own car, but I try to do all that stuff. It's kind of hard, though, to always be wearing your mask and all, but I have it with me at least, and I have the hand sanitizer.
And I think that is a prudent rule regardless,
Right.
because if you're using public transportation, you don't know where everyone else has been, who they've been in contact with, who may or may not among those people have the coronavirus, and so it's only safe to do so.
Probably, if you've been taking public transportation or even just riding in your friend's car, might not have been a bad idea to have the hand sanitizer the whole time, even before this,
Precisely.
right? Employers are to keep workers 6 feet apart. I could read the whole rest of the thing, but why don't I do it because there's a little more information. Employers are to keep workers at least 6 feet apart to the maximum extent possible. When they can't be more than 6 feet apart, employers are required to wear face masks. When workers have to be within 3 feet of each other, employers should consider providing face shields. Now, what I'm seeing a lot of are these plexiglass windows.
Yes.
They seem to be doing that at all the drive-thrus. It's working out really well. And then I saw a thing in the news last night, even the casinos that are getting ready to open are putting up plexiglass barriers at like the blackjack tables.
Yeah, you got to take the precautions that you can take in order to be able to show that we can reopen our businesses and do so in a safe manner, and a plexiglass divider between seats is one of those ways.
Businesses are restricting travel to essential purposes only and are to continue to promote people working at home. I think that's obvious.
Yes.
And then employers are prohibited from, this is big, so if you're an employee, listen to this, because all this other stuff's been for employers, and this is for both. Employers are prohibited from firing, disciplining, or otherwise retaliating against employees who stay home or leave work when they are at particular risk of infecting others. So if you have COVID-19, your boss says, you got to come to work. You say, no. But I think it would be judicial to get a note from your doctor, right? And then you're really clean on that whole thing, right?
I would think so too. It's always best to have some sort of hard evidence that you can provide that says, no, I absolutely am sick. I'm not just saying that.
All right. So those are the 10 tips for businesses that are opening, and good that you know all that as well. There's really not a whole lot new there. It's just good that we take a minute, remind ourselves of what's going on. Patiently waiting via Zoom from likely somewhere in Pleasant Ridge, now with a big smile on his face as we put him on the screen, is Kurt Metzger, the mayor of Pleasant Ridge and a former Census Bureau employee. Mayor Metzger, thank you very much for joining us today in the Megacast.
Good morning. It's a pleasure. Pleasure to be here.
Well, good to have you. So we always ask, we see all these great images from Zoom where people are at home. Tell us where you're at, what room you're in, how's everything going at the Metzger house?
The Metzger house is great. I mean, it's just my wife and myself. And we have been basically staying away from everything, at least all stores and everything, since early March.
So you haven't even gone to the store?
No, we have not gone to the store. We have relied on Instacart and InstaKids.
Okay.
We have a son who lives in Oak Park with his family and a daughter who lives in Beverly Hills with her family. And they quarantined for quite a while. In the midst of all this, I know you were talking to Henry Ford. Our daughter-in-law had a baby on April the 6th. So at Providence, sorry. Or no, I'm sorry. It was at Beaumont.
Beaumont, okay.
And everything went well, but everybody stayed pretty much isolated. And then about 2 weeks ago, we decided we could get together as family. So that's all we've been doing is only family gatherings.
Well, that's remarkable because I have, being an essential media person, I've been out a little bit, not a lot less than normal, but I have been coming into the studio. We've got 3, sometimes 4 people here. So I have been coming in, but you've not left your house. I mean, other than, right. I mean, you've been landlocked for 2 months.
And loving every minute of it.
You are. So tell me. I mean, seriously, are you? I mean, that you could tell me the truth, just between me, and thousands of other people listening and watching.
No, I mean, the one thing that we did miss was being with our grandkids and our children. And now that we've been able to do that, we walk around Pleasant Ridge. It's not a very long walk. And we see a lot of our neighbors at a distance, and we wave, and we've done some parades, and we've done some other kinds of things. So we don't feel the least bit hampered. I don't like shopping, and so it keeps me away. I have no desire to go to any stores. I can get anything I want online. So no, it's been great.
I couldn't agree more with you, Kurt. I'm not a big shopper either, and had I made a really big Costco run before all this started, I probably would have been fine. I made a couple trips to the grocery store, but trying to do what you're doing a better job than I applaud you. And so many Americans have done an amazing job staying at home, and that's why yesterday we had the lowest death total here in Oakland County that we've had, in over these 2 months that we've been tracking all this. So. Good job.
No, and I've been really impressed with as we walk around Pleasant Ridge. According to the Oakland County data, we've had 8 cases and 1 death, which is pretty low, and we've seen tremendous adherence to all the governor's her suggestions, and everybody has been maintaining that distance. They've obviously there's some wine parties at 5 o'clock where everybody stays well separated, and everybody seems to be having getting a little stir crazy. Certainly my daughter has 4 children, and that gets a little bit much, and my son has now 2. So I feel sorry for a lot of the parents. You can see them early in the morning, whether it's cold or rainy, they've got their kids out walking the streets just to get them some exercise. So it's great. And the other question was, I'm sitting in my office across from my bedroom, so
excellent.
Very comfortable.
Well, thank you very much for joining us today. He is Kurt Metzger, the mayor of Pleasant Ridge, and a former Census Bureau employee. We'll talk more about Pleasant Ridge and small communities in a moment, but let's talk about the census. Really, why we wanted to have you on today, and any thoughts for folks? I mean, everybody should have by now. Virtually everybody received the mailing with the census information, and hopefully a lot of people returned those. But you've been in the middle of all this in the past. Does that? There's a lot of people that probably don't return them and need a little extra help.
Yes, Michigan is doing quite well. They tend to in past censuses as well. So Michigan ranks 4th in the country in terms of the response rate, which is extremely good to see. Oakland County is ranking 7th in the state of Michigan, but it's already about almost 75% of households have responded, which is high. I mean, so I'm really pleased. There's quite a bit of variation within the communities. With Huntington Woods, interestingly enough, has led the country since the beginning in terms of response rate, and now is 90.6%.
Mm-hmm.
And they're, you're not going to reach 100 because there's always vacant homes that have to be taken out of the process later on as the census goes on. You'll also find that the thing is there are many parts of the state, particularly the areas that are now opening up for bars and restaurants and other things, the Upper Peninsula and the many counties in the Northern Peninsula, where the Census Bureau does not do that online. What they do, because you don't have necessarily regular addresses, they go through a process called list leave, where they actually will be delivering questionnaires, dropping questionnaires off and recording addresses. Could be a rural route, could be something else, something to identify the home. And so you have counties like Keweenaw County, which has a response rate now of about 19%. Those are people who probably have seen ads, called the Census Bureau, called the 2020 line, maybe went online, but they didn't get that card in the mail that many of us did. And unfortunately, because of COVID, the Census Bureau has now delayed most of their activities 4 months. So they're not sending people out. Some states, as states start to open, Census Bureau starts sending people out to go to homes and do this list leave process. There's also a follow-up process when at a certain point in time, which would have been now, but has now been delayed several months, the Census Bureau sends people out to homes to addresses from which they have not received either a online response or a questionnaire back in the mail, and to follow up to make sure that they get the response or to identify the home as a vacant home.
Kurt Metzger is joining us. He's a mayor of Pleasant Ridge, former Census Bureau employee, and clearly knows an awful lot about the census. So we appreciate that. So let's just start at the top of the list. Right now, during the coronavirus, the best thing that folks can do is get on a website and fill out the information, because if they haven't done that yet, what you're doing is you're forcing somebody to come knock on your door to get that information. You probably don't want extra people knocking on your door right now, and do you really want to be responsible for somebody to have to come to your house and collect that information when all you got to do is go online and provide it? Wouldn't you want to encourage people to get online and do that?
Oh, definitely.
Yeah.
This is the first census that the Bureau has done an online response. And in fact, maybe it's a great thing that they did, because you can easily go online. Just go to the Census Bureau's website and go online and do it. You can also, if you don't want to do it online, or if you have a problem with that, you can call the Census Bureau and do the interview over the phone and complete it that way. That way you've done your civic duty. Your community will get representation. Your state will get representation, and you won't have anybody knocking on your door bothering you.
So easy, online or on the phone, do that.
Right.
Otherwise, someone's going to come knocking on your door. So go to the Census Bureau website. We have links, by the way, on civiccentertv.com.
Right.
Really easy to find it. Should people, I know people are told over and over and over again, Kurt Metzger, that this information is not going to tie back to you personally. Anything you reveal about what's going on in your home during the census is just used to collect data. And, people with a questionable immigration status or anything else, they really don't need to worry about providing census information. Is that correct?
That is exactly right. The Census Bureau does have a confidentiality clause, and anybody that works for the Census Bureau, when I did, I had to agree to never release any individual information or share individual information. The Census Bureau doesn't do that. They do have the program that after 72 years, the census forms are sent over to the National Archives, so people can do genealogy research. It used to be 72 years was seen as a lifespan, so that most people would have passed by the time the data were available. There's been talk from time to time about extending that time period because people are living longer, but I think it's stayed at 72 years. You do not, and also to emphasize, and I appreciate how much you're up on the census, that the census only has, it's 9 questions. I mean, we're not asking about your income. We're not asking how many toilets you have. We're not asking any of the kinds of information that people get excited about, although they would give any information for a credit card. They don't like to give the information to the government. So it's some very basic in terms of age, gender, your race and ethnicity, and just some really basic questions that are being asked. Takes very little time, and it's so important on so many levels. But yes, the information, what happens is when that information goes in, the Census Bureau publishes data at various levels of geography, but they eliminate all names. So you'll get information for any city, village, or township, for the county as a whole, for the state as a whole. And it actually goes down to your census block, so that information is then used. The counts of people by block are used for the redistricting purposes later on.
Well, it's really important. We got to run, Kurt. I appreciate you taking time with us today. Kurt Metzger, Mayor of Pleasant Ridge, and a former Census Bureau employee. I appreciate the information. Let's check in again, because I got to keep reminding people what's going on here. And, I think the one other thing that is a little bit of a challenge this time around is that, yes, they have delayed the process a little bit because of the coronavirus. And, people just like some people, I'm one of them, they're just going to naturally procrastinate and let everything go to the absolute last second possible.
And just one last thing
Sure.
is so important that the estimate is that for each person represents about $1,800 for the state per year. So, and the census covers a 10-year period. So when that census is taken, those numbers are used for the next 10 years. They're used for federal application of funding. It's so critical that people do fill out the census. And of course, we know that it's going to be used for reapportionment. We expect Michigan is going to lose another congressional seat after the census, but it's very important for people to have their voice and have themselves counted for both money and for political representation.
Well, no question about it. And, and as the population in the city of Detroit declines, too, it's really important for people in Detroit, in every community, to make sure that they are measured and they are counted, because there's certain federal funding programs and other programs that are based on not only the number of people in your community, but just the general size of your community, and that fits into different categories. So really important. So, Kurt, I'm sorry, Kurt, we got to run, but you had one final comment? No, go ahead.
I'm just going to say, unfortunately, Detroit's rate is less than 50% right now. And so a lot of work to be done.
So if you know somebody in Detroit, it might want to recommend they get their census done. And for that matter, in any community. Kurt Metzger, thank you for joining us. We got to skip along. We'll be back in a moment. This is the Megacast. I'm Dave Scott, joined in the studio by Erik Jones right now, and we will be right back.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions. So I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055. Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford.
All right, we just heard that, so we're going to move along. Sorry about that. Thank you for joining us here on the Megacast. I am Dave Scott, and we thank you for joining us on our radio stations, 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS, 89.5 Avondale Community Radio, Birmingham Television, West Bloomfield Civic Center TV, serving West Bloomfield and other communities, civiccentertv.com, and thank you to our good friends in Walled Lake who have us on the Walled Lake Schools Facebook page. So we got news just maybe an hour or two ago that the state of Michigan is going to send ballots for the next two elections to every voter in the state of Michigan. Let's check in with our friend and local voting expert, the clerk from West Bloomfield Township, Debbie Binder. Clerk Binder, hello. Welcome back to the Megacast.
Hi, Dave. Thank you for having me again.
So good to have you. So that's the breaking news today. Did we get that right?
It's a little bit incorrect. Let me straighten that out. Okay. So we just got news as well. The first Bureau of Elections information came to us this morning. I think it probably broke to us after the news. But what they are going to be doing is sending absent voter applications to everyone who is not already on the permanent absent voter list. So that's what we understand is going to happen. So people who are already on our permanent absent voter list, our absentee ballot applications won't be going out for about another week, which was planned ahead. We didn't know this was coming, but the people who are on our permanent AB list are not going to receive those applications. It's only going to people who are not already on the permanent absent voter list.
Okay, so basically what is going to happen is everyone in the state is going to be invited either because they already were an absentee voter or if they are not, they're going to get an invitation to participate as an absentee voter, every voter in the state of Michigan, for the May and the fall elections. Is that correct?
Correct, but it's important to remember that absentee voting is a two-step process. So first you have to fill out an application and send that in, and then we send a ballot. And the way I explain that to people that makes sense is if we sent in a ballot in perpetuity to an address, that ballot would keep going to the address, people would move, people would pass away, that ballot would keep going. So we send that application until we have reason not to send it anymore, that someone has died or there's a reason that they wouldn't receive it. We've been notified that they've moved. But when we receive that application back, we verify the signature against what we have on file, and then we send an absentee ballot. So it is a two-step process.
Okay.
What they're going to be sending is that application. Again, we're going to send our own to people who are on our permanent AV list, permanent absent voter list. They don't get a ballot, they get an application. What the Secretary of State is in the process of sending and has sent to some areas already is an application, so that yes, it will be like an invitation to join the permanent absent voter list, or an invitation to get an absentee ballot for the August and the November elections, the August 4th state primary and the November 3rd state general.
I love it. I mean, I love getting an invitation in the mail to something I didn't know I was invited to. So this is really good news. Thanks for clearing that up, because I looked at the story real quick and I didn't think through it. And
yes, the ballots are not going automatically to everyone. The applications will.
Right. So you're going to get the application if you haven't already received it. Some people are essentially permanently registered, and then if you fill out the application, then the communities are going to send back a ballot, and then you vote at home. So bottom line, all this is going to create, wouldn't you say, Debbie Binder, West Bloomfield Township Clerk, a heck of a lot more activity in the absentee area.
Yeah, we've been seeing that increase since Proposal 3 of 2018 allowed for people to vote absentee for no reason. So we've seen voter habits changing to start with. We are seeing an increase in absentee, and this will definitely create a heavy increase in absentee. Just so people do know, you can call right away. If you just call the clerk's office, we can add you to that permanent absent voter list, which means you will get that application in the mail automatically from us before every election that you're eligible to vote in. Okay. And when I say eligible to vote in, that has more to do with if you're in a school district that isn't having an election, you may not, you wouldn't get an application if it's pertained to a school district that was a different school district.
Of the 7.7 million registered voters in the state of Michigan, about 1.3 million are on that permanent absent voter list, and their local election clerk mails them an application ahead of every election. So what you're saying is people can call and get on the list for your community, and I'm sure they can do that elsewhere. Then this article I'm reading in Cranes also says, additionally, some jurisdictions are mailing applications to all local registered voters. Have you done that, and are you aware of any other communities in Oakland County that do that?
I'm not aware of any others in Oakland County that do that. We normally send it to the people who have requested, and that's originally the way it was perceived. And there's some question on what the law actually states right now as to whether you're supposed to send that to people who haven't requested it. I think we're going to see changes coming in there's different interpretations, but we do send it to everyone who requests, and we've worked hard to make that opportunity available to everybody. We have done some advertising on it. We have spoken heavily about it. There have been multiple posts on the Facebook page. We have a fill-in form on our website for people to sign up for the permanent AV list. And it's as easy, again, as calling the clerk's office at 248-451-4848. We check a box in the qualified voter file, which is the Michigan database, and you will automatically get that application. So we have increased by effort, we have increased that permanent absent voter list from about 8,000 voters to about over 13, almost 14,000 voters, which we're at about 25% of our registered voters are now on that permanent absent voter list. But it's an option for everybody.
All right, and regardless of what community people are in. They can do the same thing with their community, and if somebody calls you and they're a Bloomfield Township resident, you'll give them the clerk's number over there, and I'm sure vice versa. You guys all work together on this.
We all work together. I was on with the Bloomfield Township clerk till 1 o'clock this morning. So yeah, we all work together. We share information. There's been a thread going, on Facebook and sharing information, but most of us got a Bureau of Elections. We had heard that some people were receiving these applications, but we didn't get official notice until this morning.
All right, I got to scoot along because Brenda Carter is waiting to chime in on the show here. But before I go, final question. Please, Debbie, you do a great job. Don't take this the wrong way. But we had an election not too long ago where we had so much participation. Nobody expected it, and we didn't print enough ballots, and it was really a challenge. I'm just worried here with all this absentee voting happening, and it makes sense. I mean, who wants to stand in a line 6-foot distancing and, go vote in person in this environment? I get it. I know a lot of people will want to do that. But are we really ready? And do you have some work to do in the other communities to gear up for this level of absentee voting?
I think to gear up, yes, so it's going to take more staff than we've had. But there's one where we ran out of ballots was a completely different scenario. That was it was in 2018, and the numbers were hard to predict. So the county orders the ballots, and the county ordered accordingly to a formula that they used based on prior elections, and the turnout was historic. So out of that came a committee with the commissioners, where they now allow the local clerks to decide how many ballots they'll need, knowing that the local clerks know their jurisdictions better. And we are now allowed to order 100% of the ballots for the population, or for our registered voters. In other words, for each election, if the local clerks feels that it will have significant turnout, we may order ballots that represent 100% of our registered voters. Right, so wow. I don't foresee that happening again.
All right. Well, I didn't mean to make light of that problem. That was a long time ago, and I know that won't happen again. But this is going to be a different election. I mean, we're going to have a lot more people voting absentee. I'm just thinking, and we got to go, but I'm just thinking, well, sometimes the results come out differently. It's a different process. You got to handle those ballots differently. So on another day, I'd love to chat with you about all that.
One important statement, though, that I want to make sure people are aware, because we keep hearing this myth that absentee ballots aren't counted unless they need to be. I can guarantee everybody that their absentee ballot is counted. They are, every single absentee ballot counts the same as a ballot that's cast in the precinct.
Well,
so please rest assured, if you need reassurance, call me and I will help you.
Listen, I know you well, and I can tell people that, you are on the ball and you are ready to take this thing and run with it. But it's going to be interesting. You guys, you and the clerks all over the state of Michigan are going to have your hands full for these next couple of elections. And good, the May election isn't going to be quite as big as November, because you'll have a nice little opportunity to practice a little bit, if you will, and get ready through that election for November.
Yeah, the August election.
Or August, rather, yes. It's May right now. August, forgive me, of course. All right, Debbie, thank you very much.
Okay.
Appreciate
Thanks,
it.
Dave.
All right.
Take care.
Thank you.
Thanks.
I only said about 1,000 things that were wrong in that interview. The August election. We are going to take a break. We'll be right back, and we're going to connect with State Representative Brenda Carter of the 29th District when we return. This is the Megacast.
Hello, I'm Dr. Faust, Medical Director for the Oakland County Health Division. Coronavirus disease 2019, or COVID-19, is a new disease caused by a new respiratory virus named SARS-CoV-2. COVID-19 was first identified in December 2019. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Avoid close contact with people who are sick, and avoid touching your eyes, your nose, your mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Finally, stay home when you're sick. For more information about coronavirus disease 2019, go to oakgov.com/health or call 1-800-848-5533.
Welcome back to the Megacast here on 89.3 Lakes FM, 88.1 WBFH The Biff, WAHS 89.5 Avondale Community Radio, Bama, Birmingham Area Municipal Access, West Bloomfield Civic Center TV in West Bloomfield, Orchard Lake, Eagle Harbor, and Sylvan Lake. And thank you for tuning in on CivicCenterTV.com. Dave Scott in the studio. We are delighted to have Erica Jones with us today as well. And you, and joining us now via Zoom, is your state representative from the 29th District, none other than Representative Brenda Carter. Representative, hello, welcome to the show. Good to have you with us again.
Hi, Dave. Thank you for inviting me again. It's always a pleasure.
Always a pleasure. So good to see you. Thank you. Complicated, busy day. We were just talking about ballots there. I don't know if you heard our conversation with Clerk Binder in West Bloomfield, but state getting ready to send out invitations for people to vote absentee, and that should get a lot more people in the system with all that's going on out there right now. Don't you think?
Absolutely. I think it's a good idea that everyone's voice is heard this very important election. And I also caught a part of the census with Mr. Metzger. I thought that was very appropriate for right now, too, because this happens every now and then where you have a presidential election and you have a census taking at the same time. So that if we can make things easier for the voters to be represented, I think that's a good idea.
Yeah, and I think most people know, but it's certainly worth reminding them. Representative Carter, I'll let you do it. Why is a census so important? Why do people have to fill out that information and get back?
It's extremely important that every household, everybody in the household is counted, because it gives the federal government an idea of how to appropriate money to local municipalities and states. So this is why every person, if a person does not fill out the census, that person is not counted in the financial equation. So therefore, needed money for hospitals, needed money for anything that is federally funded is appropriated based on the numbers of the people that they receive. So it's critical. It's very important, especially after coming out of COVID-19, where a lot of states are going to see a budgetary shortfall, that we maximize our ability to be counted at the census.
Thank you very much for that. I appreciate it. Thanks for reminding folks, Representative Carter. So yesterday, big news. State starts to open things up a little bit. We heard from the governor. She is going to open up restaurants and bars in Zone 8 and 6, which is in northern Michigan. And I know it's not here in our neighborhood, but you know what happens up there, I think it'll have a big impact on how quickly we can do the same down here. What are your thoughts?
I think it is a wonderful idea. I know that the governor has been watching, governor and her team has been watching attentively what's going on with the state as far as cases and as far as deaths. And as many know, the Upper Peninsula and the Upper Lower Peninsula, they have had very small cases and very few deaths. And I think it's appropriate that the governor opens up for the Upper Peninsula, because a lot of the tourism is up in the Upper Peninsula, and this is the industry that was hit the hardest. The restaurants, the social activities that we have in our state. We are a tourist state, so to open up carefully, and this is what she's doing. She's watching that when the bars and the restaurants are open to a limited capacity in the Upper Peninsula, that they don't have a spike or a surge. A lot of the communities in the nation where they have sparse populations, like in the Navajo Indian Reservation, very sparse, very spread out, but yet and still a huge surge in COVID-19 cases. So she's going to be watching this, but I know personally that it has been her intention to open up our economy in Michigan as soon as it's safe to do so.
Brenda Carter is with us, 29th District, State of Michigan, covering much of our service area. Representative Carter, I got about 100 questions here, but rather than do that right now, what's on your mind today? I just thought I'd throw it back at you. You probably have some things that you feel are really important that you want to share with people, and I just thought I would ask you that.
Well, I really focus on safety, safety for all Michiganders, and we are facing some dilemmas that we really haven't encountered before, like COVID-19 and the economic crisis. What's on my mind? I would like to see our state open up as soon as it is safe to do so. So by looking at scientific data, looking at keeping the political engine out of this, but actually looking at the human engine, what's going to be best for each and every Michigander? What's going to be best for each and every resident of District 19. We want to know that when we go to our local favorite pubs like the Lodge or the one I like, the Harbor House, I really love the Harbor House and miss it, that we can go in there and we can enjoy us a tasty meal safely. So some of the guidelines that's being put in place by MIOSHA, by the governor's team to ensure that when we do reach stage 4 of the Michigan plan, that we can do that safely, where our small businesses and our restaurants can cater to our community safely. And that's what's important to me.
Well, and safety is important to all of us. We want to see this go well, and so we're all going to watch what happens in northern Michigan this weekend. I know the folks in the Michigan Restaurant Association are really going to be watching, because they're going to be asking the governor to do the same thing down here as soon as we can. And I don't know about you, talking about safety, I felt so good to see the numbers that came through. We had the fewest number of deaths reported from yesterday, and we are on the right track. We are doing really, really well here in Michigan. So hopefully we're going to get things opened up. Have you been watching this court case that we heard the beginning of arguments last week? Everyone in the state's kind of keeping an eye on whether or not the legislature, especially the Republicans in the legislature, will prevail on their case, and we could have a decision on that maybe this week, although it will likely go to the Supreme Court. Any thoughts on that at all, Representative Carter?
Well, I did my own research on it. I'm not part of the judiciary team or the ones involved in litigating this, but I did my own research, and I realized that there were two statutes in law, one from 1945, which was the governor's emergency powers, and then the one of 1976, which were the emergency manager's powers. So I think these are the two that's in conflict that they're litigating right now, and the outcome of that is, like you said, probably will come out this week. And personally, I think the governor did what she needed to do to have those low numbers that you're talking about. Yes, it was painful. It's extremely painful for me to be locked up with my husband, who's a city councilman, for 2 months. But the point of the matter is we are still alive. And Michiganders, where we had that huge spike going into April, we are now seeing the numbers that you're seeing right now, and that's assuring. And if we can maintain that type of flattening or that lowering with doing the things we're doing, then I'm sure that the governor is going to escalate opening up businesses, which she realizes is critical to the Michigan economy.
Well, we hope so. I mean, we hope so. We do need the economy to recover. We saw this morning when we talked to Ken Gutman from Walled Lake Schools, are very concerned about the funding reduction. So we need to get this economic engine, get taxes collected, and try to get things going as quick as we can. So we will keep an eye on it. And I know you are probably as happy as the rest of us that we're making progress on vaccines and the numbers are getting better. So we'll just keep an eye on anything. Any final thoughts today before we say so long?
Well, as always, I like to give a positive shout out to the residents of District 29. Once again, our numbers were extremely low compared to the various urban areas in Oakland County, and that took adhering to the governor's executive orders, all of them, which.
Now, we lost your audio there for a moment, but well said. And, you're right. You're right that folks have been doing a really good job here, and our local numbers have played that out. and we're seeing it all over the area. People are wearing their masks, keeping their distancing, and if their businesses aren't supposed to be open, they haven't been open. So good job to folks in our area. Representative Carter, we see you, we can't hear you, but thank you very much for joining us today, and we'll talk to you again here soon on the Megacast. So we only have a minute or two left. Why don't we take one more quick break if we're all lined up and ready to do that. When we come back, we will take a look at our coronavirus vocabulary, which helps us remind ourselves what things we should be doing, things we shouldn't be doing, and we'll get ready for tomorrow as well. We'll be right back on the Megacast.
Hi, I'm Dr. Jonae Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives. Hi, I'm Dr. Jonae Caldoun. We know.
All right, well, we already heard that. We'll get that right. Tyler, when you're not in the studio, we never are able to execute that quite as well as you do. You have some magic resources over there, special buttons that you hit, so we don't play the same PSAs over and over again.
I do. I just have the magic touch.
You do. You just do it so well. So thank you for popping back in the studio. Tyler Keefe, Dave Scott, I know we only have a couple of moments left here. Tyler, I thought before we said so long today we would run down the COVID-19 vocabulary. Have you been doing this in the days that I have not been here?
Now, we've been so tight-packed with content with our guests, we haven't gone through it very much, so we need to. It's overdue.
So these are the terms that have come up through this whole process, and in addition to just making sure we know what they mean, because they are a part of our everyday culture now, it's also a really good reminder of some of the things that we need to do to continue to flatten the curve. And speaking of flattening the curve, that's our first term on our COVID vocabulary 19 for today.
And that's a community-wide effort to ensure safety measures are being taken against COVID-19 so we don't see an exponential rise in cases.
And we've been doing really good. Best numbers we've seen in the past 24 hours. It started out as social distancing, but it is physical distancing.
That's keeping a safe distance from other people, about 6 feet or more, which lessens your chance of spreading the coronavirus to them through air.
People need to work on that. That's a hard one. We're probably maybe a foot too close right now. There you go. I see a lot of places, they're really doing a good job. They're putting markings on the floor and trying to help out people keep their physical distancing. The Happy Birthday song.
That's a song you're suggested to sing twice over while you're washing your hands in order to get the most effective length of a wash.
And asymptomatic.
If you're asymptomatic, you may be carrying the coronavirus but not showing symptoms.
And we continue to learn more about that. They're saying a lot of people have been asymptomatic and continuing to spread the coronavirus. It is a big challenge in identifying what's going on. New normal.
That's what we're facing. It's the new status quo of our lives as a result of what we've experienced during this pandemic.
I wish Erica was in here because a minute ago off the air we were chatting during a break and she said, I don't want none of this new normal. She was much more articulate in the way she expressed herself. But she said she doesn't want the new normal. She wants the old normal.
Yeah, don't we all?
I get that. Curbside testing.
That is quick, expedient testing being done usually through a drive-through method, and you get your results pretty quickly, too.
Abundance of caution.
It's taking extra precautions to make sure you're not picking up or spreading the coronavirus.
PPE.
Personal protective equipment. That's face masks, face shields, gloves, and so on.
See, at first I thought that was just the shields, and then I realized, no, that's everything. It's all of it. Oh, yes. Coronavirus pandemic dreams.
Those are weird dreams that people may be having right now because they're either stuck at home and they're not getting the usual stimulus of the day, or they're at work and they're extra stressed during these crazy times, and so that extra stimulus is causing them to have weird dreams.
And if you're opening your business, you're one of the companies that is reopening right now, you need to let the health department know when somebody in your office reports coronavirus symptoms, or at least it actually contracts a coronavirus in your wear, so they can conduct contact tracing.
Contact tracing is making contact with other people that are in close proximity or may have interacted with someone that has tested positive or symptomatic for coronavirus.
This one came from Dr. Two Wheel, who is with us, and we got to zip along here, but non-dominant hand.
That is the opposite hand than you usually use for most activities, like writing or grabbing a doorknob or something. You should use that opposite hand so that you're less likely to scratch your face with a hand you've come in contact with.
And finally, facial covering displacement.
That is when you put your face mask on in the wrong way and it's not properly covering your nose or your chin. And then, Dave, we got another one over the phone last week
Yes.
from a local
You
resident.
got 10 seconds.
COVID foot.
What is COVID
You're walking
foot?
people are out walking so much because they can't go to the gym. They're injuring their feet.
And COVID foot. Okay, we'll add that one. Hey, that is it for today. Thank you very much for tuning in. Really good to have you. Thanks to all of our guests. Very informative. I would say it was not the most exciting show we've done here, but probably one of the most informative. Good to have all of our guests. We thank each and every one of them. We thank you. Thanks to our stations along the way. And thank you very much for watching and listening to today's edition of the Megacast.